The purpose of this presentation is to provide information on my allocated disease, which is pneumonia. In this presentation, I will talk about the burden of disease and the nature and symptoms of pneumonia. It is stated by the Australian Institute of Health and Welfare that there is no comprehensive data currently available on the incidence of pneumonia due to the nature of the disease often being short-lived and requiring minimal healthcare intervention. The elderly are a population group that are considered to be at higher risk of contracting pneumonia, and this can be seen on this part of the table where the average age of the community-acquired infections is 69.3. Some of the reasons for their susceptibility include having more underlying health conditions which diminishes the immune system's responses. Also, due to the elderly being more likely to be hospitalised, they are at a higher risk of being exposed to hospital-acquired pneumonia or other institutions like nursing homes. They are at an increased risk to more contagions. The incidence of pneumonia within the elderly community is attributed to physiological changes linked to the progressive decline of the respiratory. In this graph, you will see the average mortality from pneumonia between 2015 to 2019 in comparison to the amount of deaths in 2020 and up to the 27th of June 2021. In this graph, it is made evident that the trend for the mortality of pneumonia is decreasing, except for the outlier in 2020 from week 13 to week 15. Pneumonia is an acute respiratory disease that is often spoken about with influenza, due to influenza being a common cause of pneumonia. As stated by the World Health Organization, pneumonia causes an individual's alveoli to fill up with pus and fluid, limiting oxygen intake and making breathing painful. Pneumonia can be transmitted by viruses and bacteria that are commonly found in a child's nose or throat, and if inhaled can infect the lungs. Another way of it being transmitted is through airborne droplets from coughing or sneezing, as well as through blood. Some symptoms of pneumonia include rapid breathing difficulties, fever, general malaise, loss of appetite, abdominal pain, headache, chest pain, cough, and cyanosis. Two risk factors of contracting pneumonia, as stated by the World Health Organization, are having pre-existing illnesses such as symptomatic HIV infections and measles, as well as parental smoking. Two protective factors from contracting pneumonia is by keeping a healthy immune system, particularly amongst children, as well as due to the transmission through airborne pathogens. A protective factor would be wearing a face mask, and due to COVID-19 affecting policies within Australia such as mandatory face masks, it has seen a decrease in the mortality of pneumonia. This is made evident by the Australian Bureau of Statistics, where it is stated that pneumonia and influenza had the highest proportional rate decreases of all respiratory diseases, with a drop of 45.8% from 2019, and is the largest drop recorded over the last 10 years. In conclusion, although there has been a recent drop in previous years in the mortality of pneumonia due to policy change from COVID-19, it should begin to go back to the normal average rate with the immunisation of COVID-19, which will come with some removal of policy changes that prevented the transmission of airborne pathogens such as pneumonia.
Quick